Health Beat with Dr. Vanita Zahn.
The rollout of the COVID vaccine has been anything but smooth, and the amount of vaccine allotted to each state not keeping up with the number of folks who want to be vaccinated. Add to that the addition of the so-called 1C group, folks 65 and older, and those with underlying health issues. Well, they were just added to the Vaccinate Now list on the heels of the 1B group, 75 plus, while the 1A group, healthcare workers and all, were still being vaccinated. For people living with physical challenges, all this has them angry. Blaise Bryant and Denise Denoto are with Consumer-Directed Choices to explain.
Hi, Blaise. Hi, Denise. Good to have you with us.
Thank you for the invitation.
I want to start, before I get to what's given you all heartburn, I want to talk a little bit about consumer-directed choices. This is something we have discussed on this program before. It looked for a while that the governor was gunning for it, but this is a program that allows folks with physical challenges to select their own care provider, get them paid for, and live at home to be as independent as they possibly can. Did I sum that up pretty much?
Pretty much, yes. You did. People with disabilities who are eligible for long-term care have the right to receive that care in their own homes with the caregivers of their choosing through a program called Consumer-Directed Personal Assistance. And what we've seen, anecdotally, we may not have the raw data to prove it, but a pandemic is a perfect example of why someone would choose to receive care in their home rather than an institutional setting.
So do you feel comfortable that your message has gotten to the governor about the value of consumer-directed choices and that you will be funded and able to go forward?
The important thing that he said is we would have to cut healthcare in the middle of a pandemic. Do I feel comfortable that our message has been reached to the governor? I never do. Maybe that's me being very jaded and very into the weeds of our fight, because we need to not only save this program that allows seniors and people with disabilities, the very people who are most impacted by the COVID-19 pandemic, to hire people that they know and trust to come into their home and help them with their needs, as well as being able to just pay for home care.
Yeah.
So it's really a twofold approach.
And the home care is less costly than if you were in a facility, true?
Correct. It's on average thousands of dollars cheaper per year to care for someone at home than in an institutional setting. And I think anyone who requires the type of care that we're talking about intimate personal care, bathing, dressing, grooming, assistance with meal preparation, shopping, laundry. If you require that level of assistance, you'd like the independence to be able to pick and choose who's coming into your home to do those tasks, especially during a pandemic when there are concerns about infection control or spread, disease prevention. I know it has made me and my family feel better that I've been able to have frank conversations with my staff and say, you're not coming in unless you're wearing a mask.
Right. And that brings us to really the introduction to the interview with all of you, is that you've got concerns about who is being included in the vaccination rollout and who is not being included. When the governor, because the Fed said 65 and plus and those with underlying health conditions can now sign up for the vaccination. Is that enough? Has that comforted you, made you feel that you are now part of the community that can get in line for vaccine?
Well, personally, as someone who would now be eligible, yes. However, I know that my staff, my personal assistant staff, are having difficulty finding vaccinations because of the rollout of the program. There have been challenges in getting people who were eligible 2 weeks ago. Look, I'm very, very glad the governor opened up eligibility to personal assistants working in consumer-directed programs. That's wonderful. These are qualified and and frontline healthcare workers that deserve to be vaccinated with other healthcare workers. Absolutely. But the challenge of finding locations to get a vaccine through the system, which crashed when the telephone line opened up, the website was given out, and people had difficulty utilizing that. It has been a challenge.
So let me ask, I jumped on and I was able to get an appointment. Granted, it's in April. A number of us jumped on to see if we could do that. Those who, if you have an underlying health condition, if you've got, if you're of a certain age. So a lot of us took a look. My question to you, and they ask a question, is if you need some assistance. Is there enough accommodation, do you think, being made for people with disabilities who can get and do sign up and get the appointment? Enough accommodations for folks to go and actually get the vaccine?
I don't believe it's immediately clear what they're defining as underlying health conditions to start off with. Because of that data not being as clear, it's really hard to say if the necessary accommodations are being met. This, yes, Denise said it perfectly, that it's great that the governor has opened up eligibility for personal assistants who assist consumers utilizing consumer-directed personal assistance. This plan, however, has felt very much like a moving target in a period where certainty must be prevalent.
So I'm looking at the clock. You know, we're always held to the clock here. Before I let you go, so there's still a concern about getting the vaccine. Denise, Blaze, do you qualify now?
I think so.
And nobody here is 65 and older, so you know, but you, because of your health condition. So Blaze,
because of my disability, I'm assuming that I would qualify.
Right. Have you jumped online to see if you can get an appointment?
Not for myself. I did help my personal assistants who have limited technology experience try to navigate the online system so they could get on.
It's not that hard. I jumped on because I wanted to see what it was like. It's not that difficult.
Right. No,
you just got to keep scrolling through to find one where the line on the bottom is purple once you get to a location, because that means there are still slots available. The ones that are around the corner, those are all filled up. So give it a whirl and then let me know. Let me know how it goes for you guys, and we'll continue the conversation. Blaze Bryant, Denise Denoto with Consumer Directed Choices. Thank you. Thanks so very much.
Thanks, Benita.
Thanks for joining us. We're going to keep you posted on the continued rollout of the vaccine, and you can find information on how and where to register to get your shot by going to the link section on the WNYT website. We'll see you next time.